Let's talk about men's health.
Men's health.
As a surgeon, I'm sure you interact with different kinds of patients, men, women, young, old.
Yes.
How do men take their health? How do they approach their health? Is it different? Is it just the same way? Do they delay to come to hospital? Are they pressed with issues so much that they forget about themselves?
Yeah, and the total observation is that men will come to hospital when it is so serious. Mm-hmm. When it is so serious and therefore slightly advanced, whichever disease, be it pneumonia, be it cancer, etc. And I think there is some evidence to this, but I will have to read a little more. But what I observe in the ward is you will find that the men will come slightly later than women. What I see in the social circles that might influence the health-seeking behavior is that ladies are more socialized in groups, and they are quickly able to say, hey, I'm feeling this. Are you guys feeling this? Like they can really share, they can hug, they can be very close and open with each other. Men, we tend to be a little of lone rangers. I'm sure you belong maybe to just one chama or just one social group where you share issues. Women have got many, fora. They are always meeting over tea. They are always discussing something. They are being vulnerable with each other, and that kind of, that openness, I think trickles even into health-seeking behavior. And I think it's something as men we need to learn from women to just share our struggles with one another and see how that goes. I don't know if we have been, grown to and cultured to feel that men should be macho, men should not show vulnerability, men should be there when everyone else is sorted out. Now they can say, I am also hungry or I am also hurting, when they know that the wife has been taken care of and children have been taken care of. Now is the time to say, okay, I also need something. I'm also feeling like this. I think the gender role assignment right from growing up has been you provide for others, and then you can survive with your struggles. You are bigger, you are stronger. These things should not break you down. You were just mentioning to me before we started that there is all this, which is in so many cultures, that men should not cry. But crying is not a cultural problem, it's a biological thing. You feel it, you break down, and now we want to hide. We don't want to show that we cried. So I think it's a complex phenomenon. I am sure psychologists and mental health experts have those perspectives, and neuroscientists have those other perspectives. But there's a lot of expectation also placed, I think, on the man, and the vulnerable side does not come out. So by the time you are seeking help, you are in the extreme end of things. That doesn't augur well. If you go to the ward anytime, and I have a colleague who talks a lot about that, you go to a ladies' ward, the ladies, they wake up, they shower nicely, and they're in the hospital. Yeah, even in the hospital, they apply some oil nicely, they are looking presentable even when they are struggling with disease. Men are disheveled, they are to be forced to go brush. The lady has more visitors who are not even blood relatives, maybe the Kikundi. The chama members have come to visit them. The man, maybe not so much. So the generation of the man, we really have to look out for them. Otherwise, they might ebb away without our attention in the imagination that I am self-sufficient. I don't need people to come or something like that. Those are interesting things, and I really also would be excited to find out what you will find out in this endeavor, and on how we can help the boy child in the entire spectrum of things.
Another question still on men's health. There are habits and lifestyle that they tend to be also male predominant, and how they impact health. So I'm saying something like alcohol, smoking, nyama choma. Yes, those are habits that anyone does them, but predominantly males.
Does
that impact men's health, general, not just mental?
Not just mental
from your perspective as a surgeon.
I think it does. I think it does, because especially when you're coming for health checkup and we're talking about non-communicable diseases and cardiovascular diseases, a lot of alcohol intake will always put it as a risk factor for quite a number of things, a number of cancers, a number of non-communicable diseases, junk eating, which most of the time might go with alcohol intake.
Yes.
The nyama choma you're talking about, the fast food, and now people are coming with elevated cholesterol, people are coming with high levels of uric acid, just because of the diet that you're talking about, because maybe the socializing behavior has been, come, let's catch up over a bottle of beer and over a kilo of nyama choma, mbuzi choma, and something else to go with it, and that goes on a tad too many times. And then not because the eating is bad, but because it becomes habitual, then probably someone drops their workout habit, and then that makes it deleterious to their effect. When you look at how we've grown, I have been to countries where I think women smoke more than men. In Kenya, I think we don't have as many women smokers, but in the urban centers, you have them. I actually remember one time we were in the club with my wife, and asked her, do you think there are more ladies in this club than men? And we started looking around. There was still more things. So ladies would come in like a group of 2, 3, or 4, and they take a table and they start drinking. And I started wondering, okay, many ladies are not beating us to our game as men. So in another maybe decade or so, we might have that problem shifting. It might shift. I don't know, but I project it might shift, especially in the urban. But in the traditional sense of things, maybe women didn't drink a lot. Smoking isn't an issue a lot in the females. Unless those cooking in poorly ventilated areas, and therefore they're just having that smoking firewood, the old ladies. So it's cultural thing, and I think it goes to that extent. But at the moment now, the tide keeps shifting. But anyone taking alcohol, anyone who is not eating healthy, anyone who has not taken a healthy lifestyle in terms of balanced diet and exercise, and anyone who is engaging in sedentary lifestyle, they are at risk. Communicable diseases, lifestyle diseases, even cancers now. And that shoe is shifting from the male gender, slowly creeping to the ladies who are otherwise safe.
Do you mind just mentioning a few, just for the sake of the men? A few, let's be specific, cancers that are related to alcohol, smoking.
Well, you can mention so many, really. You can mention so many. Any cancer you mention, I want to be very clear on this. Any cancer we mention, alcohol intake and smoking will be on top. But if you come to smoking, for instance, what we know we always tag as a risk factor to smoking is lung cancer. Okay? It's lung cancer. Again, I said any cancer, you can say cigarette smoking and alcohol intake is a risk factor. When you look at heavy alcohol consumption, one of the things we look at is liver. So alcohol will most probably give you lead to liver failure, and a certain liver dysfunction will years down the line lead to cancer, transformation, cancer of the liver. But even the stomach, and the esophagus, a lot of heavy intake of certain kinds of cancer will lead to certain changes that slowly over time can predispose to cancer of the stomach. So even when we are talking about cancer of the stomach, we will look for years of smoking, years of alcohol intake, and exposure to certain chemicals, and say these are risk factors for cancer development. So granted, what is happening with cancer, because of the long time it takes from the time you have been exposed to that causative or risk factor to the time you develop cancer, is in surgery and in medicine in general, we do not say this is what caused the cancer. We say, oh, these are risk factors, except a few where you know, okay, Epstein-Barr virus causes this cancer. This other virus causes this cancer. Human papilloma virus causes cervical cancer. But most of the others will say these are risk factors. Yes.
All right. And risk factors work together to eventually
absolutely, yes. So what happens is you slowly getting one hit, another hit, another hit. You can imagine someone who is panel beating a metal. With every blow, the metal is bending. If you meet him here beating a straight rod, when you come back next year, it will have taken a semicircle. When you come after another year, it will become a U. So that is what happens with our bodies and those risk factors. If you are taking something that is irritating your stomach or irritating your esophagus, and you keep irritating that cell over and over and over, outside of what it was meant to be irritated, then at a certain point X, it will have been so irritated that it will turn into a dangerous looking cell, and that cell is the cancer cell. And those heat can come in the way of smoking, it can come in the way of alcohol intake, it can come in the way of various other, what we call chronic inflammation, which is an irritation of a certain cell. Yes.
Okay. Last question on men's health.
Yes.
Just something about the prostate.
Yes.
For men.
Yes.
The prostate is important for men.
Yeah, absolutely.
It is, yes. So just maybe one or two things that men should look out as far as prostate health is concerned.
Absolutely. Yeah, prostate health is important for male. It's one of the isolated cancers that only attack males. Okay? In breast, we say maybe 98-99% is for ladies, but still the 1-2% can attack males.
Yes.
But for the prostate, we haven't had a lady who gets prostate cancer because prostate is a gland only available in the male because it's supposed to produce some fluids that are helpful in the reproductive health. There are two things. As men grow, the prostate size also grows. Actually, we say at a certain point, you can look at the size of the prostate and corresponding to the age of the patient. The patient is 70, their prostate is probably 70 grams or something like that. You can use that perspective. What happens is prostate cancer can develop as someone grows. And that cancer is one of the cancers that depends on the testosterone. The human testosterone, which is the human reproductive hormone, to facilitate the growth. Now, the prostate problems, whether it is cancer or just prostate enlargement, which we call benign enlargement, will present with certain symptoms. And these symptoms are called urinary symptoms, or urinary tract symptoms, or lower urinary tract symptoms. We usually just classify them in terms of, are they irritative, in terms of, are you just going to the toilet frequently? Are you feeling like your urine is burning? Are you waking up at night many times? These are irritative symptoms, okay? And then we look at, so we call them FUN, frequency, urgency, and nocturia. It's not fun. It's not fun, but you can use that acronym. Are you going very many times? Are you waking up at night? Or do you have some urgency, you can't hold, you have to run. And then they are what we call obstructive, okay? So when you go to the bathroom, if the stream was going far, like the stream of urine is going far, now it is just dropping close, and maybe it is not coming quickly, it's just small drops, and you have to strain and push it, and when you just finish, you feel like, I've not finished enough. I've not emptied completely. When you want to go out and zip up, you have to go back and completely empty the bladder. Now, all of these can be assessed, and it's important. If you feel this, you have to go and get checkup. But even if you don't feel them, it's important to get checkup. Maybe from 40. Once you hit 40, just go for your annual checkup.
That's what I wanted to ask. When should men start getting serious evaluation about their prostate?
Yes, now we say at 40 years, get an annual checkup. When you go for the annual checkup, the doctor might do a digital rectal exam. They might also do a test called a PSA, which is one of the chemicals we assess that is produced by the prostate, which is prostate specific antigen. And they're able to tell you, hii ni kawaida. Unafaa kutoa kama hii. If it goes past this, hiyo prostate yako either iko na infection, ama tunaanza kutafuta kama hakuna cancer. So when you start going, it's a good habit. And I've always been an advocate in the spirit of gender equality to turn, the way we have breast cancer awareness month in October, make it health awareness month so that everyone goes. Come on, prostate, men get checked for prostate. So it's just a physical exam, one test or maybe two tests. And from there, the doctor is able to advise. Granted, most of the time, we don't have, we may not have cancer. It may just the prostate that getting enlarged, and you can get that advice. The other good thing about prostate cancer actually is there's a lot of movement in science to move prostate cancer, especially the low-grade prostate cancer, from being called a cancer to just being called a chronic illness. Because it is an indolent, it's a slow-growing cancer. Actually, we say in some instances the doubling time of prostate cancer could be up to 10 years. So if you have 1 gram of cancer now, by the time it gets to 2 grams, it's 10 years down the line. That is why when we catch it in the elderly people in their 70s, we tell them, do you have a life expectancy of more than 20 years, no. Live with your cancer, you
Just
might die from other things other than the cancer. So it's not that aggressive, but some of them are aggressive.
Yeah.
But those are discussions that now get tailored down to particular patients. Yes.
Wow.